if you want to know what are survival chances for your husband in ICU with melanoma in his hips and with use of oxygen, stay tuned. I've got news for you. Today I have an email from Tracy. And Tracy says, "Hi, Patrick. My husband has myeloma in his hips. He's 77 years old. He's in ICU on oxygen. They have increased. We've struggled with him being put on a ventilator and what are his chances of survival and or healing if we were to decide to use a ventilator." And my name is Patrick Hutzel from intensivecare.com. This is another quick tip for families in intensive care. So let's answer this question from Tracy. Tracy, I'm really, really sorry to hear about your husband's condition. So multiple myeloma is a serious illness that can complicate treatments, especially when it affects critical areas like the bones, hips, in your husband's case. His current situation in ICU with oxygen support and possible need for a ventilator suggests that he's critically ill, which can make decisions about ventilation more difficult. Regarding his chances of survival or healing, it largely depends on a number of factors, including the severity of myeloma. If the myeloma is advanced and has caused severe damage to his organs or bones, this may affect his ability to recover. With myeloma, for example, you will also often find that patients have low immunity or no immunity. That means their white cell count is low, they can't fight an infection, or even worse, they are neutropenic. So that would be one of the first questions that I would have for the intensive care team or for the oncologist. How severe is his myeloma? Is he immunocompromised? What are his white cells? And is he neutropenic, right? Next, his age and his overall health. At 77 years of age, his age can be a factor in how well he responds to intensive interventions like mechanical ventilation. If he has underlying health conditions such as heart disease, diabetes, or kidney failure, this can also affect his prognosis. Number 3, how does he respond to treatment? How well he responds to treatments provided in ICU, such as oxygen therapy, medication, or other life support measures, will influence his outcome, including when he gets on a ventilator. For instance, if the doctors are able to stabilize his oxygen levels, it may improve his chances of recovery. Next, ventilator use. If the decision is made to put him on a ventilator, it is important to understand that ventilation is often used in critical cases to help the patient breathe, but it does not cure the underlying disease. For someone with advanced myeloma, ventilator may help to temporarily support his breathing, but if his overall condition continues to deteriorate, it may not be a long-term solution. Ventilation use also carries risk, including infections and complications, especially in older patients. And also, another thing that when someone goes on a ventilator with myeloma, what I've also seen over the years is that they have a hard time to getting off the ventilator because, once again, they are immunocompromised and they are very weak. So, next, ultimately, the decision about whether to use a ventilator should be based on discussions with the medical team, intensive care team, who can assess your husband's prognosis, how likely he is to recover, and whether it aligns with your husband's wishes and goals for care. If you haven't already, it may be helpful to have a clear conversation with the doctors about the likelihood of recovery and the goals of using a ventilator, as well as to discuss any potential outcomes. You may also want to ask if they have considered comfort care or palliative care options, which focus on managing symptoms and providing comfort, especially in cases where recovery seems unlikely. Those are all valid points, but another question is, does he then need a tracheostomy if he can't be weaned off the ventilator? Is that something your husband would want? These are things you would need to think through before putting him on the ventilator. What I've seen over the years, and by the way, I've worked in critical care nursing for 25 years in 3 different countries, where I worked as a nurse manager in intensive care and where I have also been consulting and advocating for families in intensive care since 2013 here at intensivecare.com. And I can very confidently say that we have saved many lives with our consulting and advocacy, and you can verify that on our testimonial section at intensivecare.com, or you can verify it on our intensivecare.com podcast section where we've done client interviews. So, what I've also seen over all those years that I've worked in critical care nursing, patients with myeloma can also often end up with a pneumonia, which pushes them directly to a ventilator. And then they might have a really hard time of getting off that ventilator because they are so immunocompromised. So I hope that helps you understand, what your husband is up to, and I wish you can buy as much time as possible by advocating for a ventilator and a breathing tube, but that's also something I can help you with the consulting and advocacy for families in intensive care here at intensivecare.com, where we have helped hundreds and hundreds of members and clients over the years. And once again, you can verify that on our intensivecare.com testimonial section or on our intensivecare.com podcast section where we've done client interviews. And that's why we have helped hundreds and hundreds of members and clients over the years to improve their lives instantly. And that's why I also do one-on-one consulting and advocacy over the phone, Zoom, Skype, WhatsApp, whichever medium works best for you. And I talk to you and your families directly, and I handhold you through this once-in-a-lifetime situation that you simply can't afford to get wrong. I also talk to doctors and nurses directly on your behalf and with you. And I also represent you in family meetings with intensive care teams. And when I talk to doctors and nurses directly, I ask the questions that you haven't even considered asking, but must be asked when you have a loved one critically ill in intensive care. We also do medical record reviews after intensive care if you have unanswered questions, if you need closure, or if you are suspecting medical negligence. We also have a membership for families of critically ill patients in intensive care. And you can become a member if you go to intensivecare.com, if you click on the membership link, or if you go to intensivecaresupport.org directly in the membership. You have access to me and my team 24 hours a day in the membership area and via email, and we answer all questions intensive care related. And all of that you get at intensivecare.com. Call us on one of the numbers on the top of our website, or simply send us an email to support@intensivecare.com with your questions. And if you like my videos, subscribe to my YouTube channel for regular updates for families in intensive care. Click the like button, click the notification bell, comment below what you want to see next, what questions and insights you have from this video. I also do a weekly YouTube live, and you will get notified for the YouTube live if you're a subscriber to my intensivecare.com email newsletter, or if you're a subscriber to my YouTube channel. Thank you so much for watching. This is Patrick Hutzel from intensivecare.com, and I will talk to you in a few days. Take care for now.